For some reason, there is an 80% lower chance of you developing PTSD when you draw out your trauma after it happens.
So this isn't true. And sharing inaccuracies like this one is dangerous and causes real harm. So the original claim that drawing trauma can reduce PTSD by 80% oversimplifies a really nuanced process. So let's start with introductions, because I can't stand when people start talking about stuff that they have no expertise or no experience in. And that's not me. My name is Dr. Raquel Martin, and I'm a licensed clinical psychologist, professor of scientist, podcast host, mental health educator, wife, mother, and all-around delightful human being. I specialize in Black health and well-being and trauma. I've trained in what are seen as the gold standards, but that's like a nuanced conversation too, of trauma, including trauma-focused cognitive behavioral therapy, cognitive processing therapy, and parent-child interaction therapy. Now, there are plenty of other amazing therapeutic techniques when it comes to processing trauma, but these are just the ones that I have training in. In fact, my postdoc was completed at the Center for Family and Traumatic Stress at Johns Hopkins. In short, I know what I'm talking about. Whew. Now that we got that out the way, let's continue. Okay, so we're gonna start with the harm. Misleading information like this risks re-traumatizing people who might not be ready to process their trauma. PTSD prevention and treatment is complex. It involves more than one activity, and this is a really significant oversimplification. Now, I'm not familiar with the young woman in the original video. I just saw her video pop up in one of my colleagues' stories. However, I am familiar with the doctor that she is quoting. Her name is Dr. Martha Beck. She is a renowned sociologist. She's a best-selling author. She specializes in many topics, including anxiety. Her CV, the doctor's CV is long, and there are many accomplishments there. And many people also maybe have been introduced to her because she is, or she was at some point, Oprah's life coach. So she was recently interviewed on the Diary of a CEO podcast. I really enjoyed that podcast because they include fact checking. And here's a clip of her spouting the same statistic that the woman in the video I stitched said.
You know that if people have been through a trauma and they're allowed to draw about it, even if they can't draw, professionally, they have an 80% lower chance of developing PTSD.
Now, if you notice in the bottom, it shares that they too were unable to fact check this. Okay. Now, art therapy or writing or storytelling, they're all part of expressive therapies, which can help to process trauma because they allow people to externalize emotions and experiences in a safe way, which helps to potentially reduce emotional distress. It's also important to realize that just because you tell someone to draw a picture doesn't mean that it's art therapy. Just like just telling somebody to read a book is not bibliotherapy. These are real certifications and trainings, and it's important to me that you know this. You have to know this, okay? So drawing can help some people because like visualizing it and externalizing it helps to reduce the emotional overwhelm for some people. It also makes it more manageable for some people. Art can be helpful overall, but only when the person is ready and it's done in the right context. It's not a standalone solution. So now that we've got that out the way, let's discuss things that have actually contributed to reducing the severity of symptoms of PTSD. Now, notice my language, the risk of the severity of symptoms after exposure to a traumatic event, because there is no research. There is no such thing that states that it decreases your likelihood of developing PTSD. There are things that contribute to reducing the severity of symptoms of PTSD. And those are very different things, right? And just to let you know, the PTSD symptoms, there are 4 specific categories. There's intrusion, which is like involuntary memories, like intruding on your life. There's avoidance, which is your attempt to avoid reminders of the event internally or externally. There's negative alterations in mood and cognition, which is changes of how you think or feel after the event. This is really important because trauma not only impacts the way you see yourself, but also impacts the way you see the world and others. And there's also arousal symptoms, and arousal symptoms is things like that increase your reactivity to things. It's like hypervigilance. I was talking to, when I remember having this one patient, and she says, I stay ready so I don't have to get ready. And I was like, that is also a traumatic response to you staying ready because you were expecting the bottom to fall out. So it's like being jumpy, or I'm expecting the worst. Because once again, trauma, it changes the way not only you see yourself, but see the world and see others, right? It's also one of the reasons why a lot of individuals will state that they are empaths, but really they're just significantly hypervigilant due to trauma in their past and honestly in their present. And I'm not saying empaths don't exist. I'm not doing that with you. But I am saying of the patients that I have worked who came into therapy ready and stating that they were empaths, they were in this realm of hypervigilance that they had always been in. Yes, they were very good at like seeing the feelings of others and the moods of others, but they also got good at that because they had to gauge the moods of others and individuals who were harming them because they were living in that space. I can tell that they in a bad mood today because of the way that they're walking, so I'm gonna stay out their space. But I digress. So things that have actually been shown to reduce symptom severity. One is early intervention, and that's receiving care within 1 to 3 months after the traumatic event. There's also, it's important to realize that the most important thing is like physical and emotional safety. Nobody's trying to talk about attachment styles when you're still unsafe. And that doesn't have to be done in therapy. This is the reason why I said therapy isn't the only path to healing. No matter what path you take, it will be paved with community. Providing a safe and supportive environment immediately following the trauma helps. Talking and connecting with trusted friends and family members or community members to prevent this feeling of isolation helps. This is also another issue with this whole drawing aspect because the goal is to heal in a way that feels safe and sustainable. Trauma recovery isn't about rushing to relive the experience or following a one-size-fits-all method. It's about pacing yourself. It's about seeking support and healing on your terms. Community is helpful. It is necessary. Talking about the trauma in a space without forcing it. Joining groups for trauma survivors can provide validation and shared understanding. And these are all things that do not have to be conducted in therapy. Therapy is not the only path to healing, but no matter what path you take, community is going to pave it to make the walk that much easier on you. Now, the next one is a big one that I think is incredibly accessible, psychological first aid, which also doesn't have to be completed by a licensed mental health professional. It focuses on providing the foundational knowledge on helping individuals cope with stress and trauma. And there's a lot of organizations that provide this training. The American Red Cross teaches PFA, psychological first aid. The National Child Traumatic Stress Network, Hopkins teaches a PFA course. The World Health Organization also has a PFA guide for field workers. One thing that's really important to realize when it comes to post-traumatic stress disorder is one, everyone exposed to a traumatic event does not develop post-traumatic stress disorder. That's why people think about this, the reduction in severity of symptoms. There's also the aspect of the natural healing process of you've had psychological safety, you've been able to normalize the experience. The symptoms were higher directly after, but they've decreased significantly. So there's also time. Once again, reason why there isn't any rush in this realm. But there's just so many paths. So it's important to realize that. But you also need to realize that a lot of things that people get wrong with post-traumatic stress disorder, it's not only about directly experiencing the event. You can also be diagnosed and suffer symptoms of PTSD if you were repeatedly exposed to aversive details of the event. It's one of the reasons why first responders and everyone have to go through significant, they need mental health care too, because being consistently exposed to aversive details or witnessing it can also contribute to you having those symptoms of intrusion and reactivity or arousal and negative cognitive distortions and avoidance. So it's also important to realize. I know this is a lot, y'all, but it's free game. So psychoeducation is also a huge helper in reducing the severity, because the one thing that I have learned is that it's not solely about feeling like you're dealing with these symptoms. It's also feeling like you are the only person experiencing it. So not having the education on the normality, is normality a word, of the experiences that your mind and body are going through multiplies the stress. Because it's not just the fact that you're going through it. It's like, I'm going through this, and is it normal? Because if I don't think it's normal, I'm also feeling weird about that. So learning about the body's natural stress response to demystify reactions like hypervigilance, it also helps you. And it also lets you know the signs and symptoms when you may need to seek professional help, like persistent nightmares or emotional numbness as well. Yes, I'm currently thinking, so if anybody wants additional videos, like, cause I understand everyone doesn't want to watch a video, but like, if you want additional videos on like the symptoms of PTSD and ways to normalize it, just psychoeducation, let me know the best astrological sign and the worst astrological sign. Now, I don't believe in astrology. You're not going to convince me. Every single person around me believes in astrology. And if those that I love have tried and failed, there's no hope for you. But I do like to tussle. And I think we could all use a laugh. So yes, if you want to hear more about the psychoeducation of the way your body responds to stress and normalized experiences, more details about symptoms of PTSD and signs that you may need to see a professional, yeah, tell me the best and worst astrological sign. Because it sucks. I'm in a pretty healthy, life. So like, I don't really get exposure to messy stuff as much as I would like to. All right, next part. So the original woman, she titled her video, How to Prevent PTSD If You Were Affected by the California Fires This Week. And once again, this was incredibly wrong. But I want to give you some resources, so get ready to screenshot. And there are more in the caption. And if anyone else is aware of any resources when it comes to mental health and well-being or anything, please share them in the comments. So, and I also want to bring this full circle with the original video. The inaccuracies in that video are serious. And I also acknowledge that people get stuff wrong all the time. But if that's going to be the case, I think it's important to, and if this happens to anyone, rein it in. And it's not enough to simply delete the video. I think it's important to acknowledge why the video was deleted to help with any of the harm that was caused. Because the reason why I think some people feel comfortable just like dipping their toe or their whole body into the realm of like health and well-being is because they really do think that what we do is like platitudes and folk wisdom. And psychology is a science. I am a scientist. And when people look at your misinformation, they may take action on it. So I don't really like when people only take down the videos because without sharing why, because it leaves the harm intact. They may think maybe something just deleted it, right? So this isn't just for the individual, the young woman who posted the original video. We get stuff wrong all the time. And nobody's asking for perfection. They're just asking for accountability. So if you have recently posted something that was inaccurate after further research, and this is one of the reasons why I think the 24-hour news cycle has contributed to the detriment of critical thinking, health, and well-being of so many people. If you don't know enough, don't post on it. And that's okay. Like there's always this push to post about stuff. Oh, they need to hear my response. Not always, right? So like this isn't solely to this young woman. This is to everyone. Once again, 2025 is, let's make this the year of, you know, nuance, slowing down, critical thinking. But really, like if you post something and after learning more, you realize that you were inaccurate. I think it happens all the time. It happens to the best of us. Just have some accountability because this is a science. I am a scientist. So once again, Dr. Raquel Martin, I share information like this all the time. If you are interested in learning more, follow me because I share stuff like this all the time. And once again, if you want more psychoeducation on PTSD and trauma and stressor related disorders, signs and symptoms as well, I need to know the best and the worst astrological sign. And I'm not about to tell you my astrological sign. You know, if you figure it out yourself. I don't believe in it, but I do enjoy watching people tussle at times.